I ended up getting arrested when I was 26, and I had a young son and a boyfriend. And my life was on the outside relatively good, except I had been using drugs pretty heavily. And I got arrested and was expecting to be sentenced to a prison term. The court system offered me a drug court program, which is where you are overseen by a judge, but you're basically in drug treatment therapy. And the person that did my intake after getting out of jail told me that I had already been to rehab so many times, there was nothing that they could teach me. At this point, it was either I was gonna do it or I was gonna die. So I really dedicated myself to that program, and I utilized that opportunity as fully as possible. I graduated in the minimum amount of time. I was looking, how do I become employed with this? How do I use this as an asset rather than a liability? I went up and worked at the White House for the summer. I had, in the legal role that I was in, I had the opportunity to work on, workplace policies or ethics and things like that. About a month after I left my internship, I got a phone call from the office asking me to come back as a full-time employee in their public engagement office. I think one of the most important things that an employer can do, especially if they're engaging with employees in fields like construction, warehousing, they have a higher probability of having people that are in recovery or actively using drugs and alcohol. Those are just facts. That's like statistics show that those are the areas of work that have the highest substance use. So it's so important that those employees know that they can go to their employer to get the help that they need, because you will have employees using drugs and alcohol. There's no work section that does not have that. It could be a loved one that's struggling with drugs or alcohol, and it's causing the employee's work to deteriorate. That's another symptom of this. So employers that have workplace programs, if it could be, there's all kinds of things that employers can do to make this work in their workplace, and it doesn't have to be, oh, we let people that are actively using substances work. That's not the answer. But it could be making sure your employees know where to go to get help. It could be carrying naloxone at the workplace, so if there's an overdose, you can save their life and give them another chance to try and get sober. But it could also be ensuring that your health insurance benefits cover things like drug treatment programs or mental health medications. It can also be working with your employees who might be on methadone or Suboxone for opiate use disorder, and making sure that they are able to be employed with your company, maybe not in a role that's considered safety sensitive where those medications are prohibited, but in another role. So it's really making sure that your employees feel comfortable enough to communicate with you that they're struggling before they have an accident on the job due to hiding their drug and alcohol use. And the biggest thing that we worked on was stigma reduction. They wanted to have somebody like me there to show that this is what people in recovery can do. This is what happens when you're willing to save someone's life and let them try to make themselves better.